What is a permcath or tunnel dialysis catheter? A permcath, also known as a permacath, is a long, flexible tube, catheter, that is inserted into a vein. These are most commonly placed in the neck, internal jugular vein, and less commonly in the groin, femoral vein. The catheter is tunneled under the skin and exits usually on the upper chest or mid-thigh. A permcath is placed when the catheter is going to be in place for long-term, usually greater than 2 weeks. If the catheter is not being left in long-term, then a vascath/Quinton can be placed. A vascath/Quinton catheter are non-tunneled central venous catheter that directly enters the neck or groin vein without being tunneled under the skin. The reason for the tunneling of the permcath is that it had been shown that catheters that are tunneled under the skin before entering the vein have a lower risk of becoming infected or colonized by bacteria. Permcaths are usually held and placed by stitches but also have a cuff that is positioned within the tunneled track under the skin. Once in place, this cuff grows in under the skin and is also responsible for keeping the catheter stable. These tunneled central venous catheter can be left in place for as long as 1 year and provide permanent access in patients. However, despite being considered permanent, the longer they are in place, the greater the risk that they will eventually become infected. This is why most physicians will try to use these catheters as a bridge for finding other means of more permanent dialysis, such as an arteriovenous fistula or a dialysis graft. Fistulas and grafts are surgically created connections between an artery and vein to allow high flow for dialysis.